So this is a panel discussion, and really the goal of it was to have a bit of a deeper dive into some of the challenges and future plans around co-production in evidence synthesis. And we are really fortunate and would like to thank the fact that we've got 5 fantastic panel members, as you can see here. Now, rather than me going through and introducing each one of these fantastic people, I am actually going to stop sharing my screen, and then we're going to ask each of them to introduce themselves. And we've asked each of them just to prepare a brief 2 or 3 minute introduction, saying who they are and really what's important to them around co-production in evidence synthesis. And I think we'll go to you first, April. So if you'd like to start and unmute yourself and introduce yourself.
Yeah, thank you, Alex. And hi, everyone. Good morning or good afternoon, good evening. So my name is April English. I'm Cochrane's Patient and Public Involvement Manager, and I'm a co-convener of the Co-production Methods Group as well. So my experience, of course, spans from patient public involvement to health communications to health policy. In session 1, Alex spoke about wearing multiple hats in patient and public involvement, and I'm actually one example here. I'm also a rare disease patient myself, which fuels my passion for involvement in this work and in this group as well. So, Alex, you talked about what matters most to me in co-production. I'm going to keep it fairly simple here to start things off. What matters to me is that we involve people who are impacted by the research. And by involve, I do mean research that is done with, research that is done with or by members of the public rather than to, about, or for them. And the details of how we involve people is, of course, important as well. But what I like to say is that even thinking about involving people in research is a really good step in the right direction from my point of view. And if we can get every researcher to consider involving people, that to me demonstrates a change in the right direction. From when I remember when I was a research coordinator in one of my first jobs, part of my job was to collect what we used to call research participants. And so I really do look forward to the day when we can say that involvement is the expectation, we're working in partnership, and that's what everyone does in research, no questions asked. So I wrote down a really nice quote that I think sums up what I believe really nicely. And it's from Omar Abdi, the Deputy Executive Director for Programs at UNICEF. And he said, it's impossible to solve a problem without partnering with the people you aim to serve, asking them questions and understanding their behaviors in the context of their wider lives. So Alex, I'll pass it back to you. That was just hopefully quick intro.
Fantastic. Yeah, no, thank you. And fantastic quote. That's a great introduction. So we'll go next to Euphrasia.
Good afternoon, everyone. Hope you can hear me, everyone. I'm Euphrasia, and I'm based in Central Africa, precisely in Cameroon. I'm the team lead of Cameroon Consumer Service Organization, commonly called CAMCOSO. Our primary interest is to advocate for the protection of the rights of the consumer. We believe that knowledge is power, and an empowered consumer is one who is equipped with the necessary knowledge in order to defend their rights. So we focus on mobilizing resources in order to equip citizens, and in this case in particular, we'll be referring to the patient partners in research. So I was privileged to join Cochrane in 2017, and by 2021, I became an executive member of the then Cochrane Consumer Network, and now the Cochrane Patient and Public Network. So actually, what matters to me when it comes to co-production, as you asked, is actually equal partnership. I heard you introduce the word partnership, Alex, in the first session. Actually, when I hear of that word co-production, it speaks volumes to me in terms of partnership, that it should be something that we are in together, and that partnership should be equal. That is, I will refer to power sharing, equality in power sharing and decision making, where the patient partners' input is equally valued as much as that of academicians and researchers. What really matters to me when it comes to co-production in evidence synthesis too is reciprocity and mutual benefit. that is. I want to look at capacity building, which I like to refer to as capacity sharing. I want to look at the opportunity to acquire new skills, opportunity to network, and also the opportunity to have my contributions recognized appropriately. And last but not the least, I really an aspect that really stands out to me when I'm sorted, when my expertise or my contribution is being sorted in co-production, is the relevance of the research to real world needs, is the relevance of the research. And I think that I would be intrigued to be engaged meaningfully in research that actually answer real life questions that at the end of the day, whatever is produced can be used to improve our day-to-day living. Thank you very much, Alex. I'll hand it back to you.
Thank you very much. That was a great introduction and great perspectives you can bring to this panel. John, we go to you next.
Sounds great. Thank you very much for having me. My name is John Lavis. I'm an advisor at the Wellcome Trust supporting its initiative called ESIC, the Evidence Synthesis Infrastructure Collaborative, and hopefully we'll have a chance to discuss that in a bit more detail. Co-production has been my bread and butter for a few decades now. In my day job at the McMaster Health Forum, we produce contextualized evidence syntheses in partnership with government policymakers, a variety of different interest holders. And because of Maureen's leadership and our partnership with Maureen, we've been working closely with citizen partners for many years in that work. What matters to me, particularly in this conversation, is how we think about co-production in a world in the future where we're producing global public goods like Cochrane reviews with meaningful engagement of citizens and policymakers around the globe. So in my day job, it's easy for me to work with local citizens, local policymakers. But if you're trying to produce a Cochrane review that is applicable to Africa, that is applicable in the Middle East, that is applicable in the Asia Pacific, how do you meaningfully involve citizens in all of those different environments and policymakers, among others, in all of those environments? So when we come back to the discussion, I hope to talk a little bit about how ESIC will be putting in place infrastructure that will start to make that meaningful so we really are able to do co-production at scale. Thanks, Alex.
Thanks, John. And yeah, there's definitely questions about ESIC have been submitted already, so we'll definitely come back and give you an opportunity to expand. I think we'll all be keen to hear that. So if I come next to you, Maureen.
Thanks, Alex. So I'm Maureen Smith. I'm from Canada, and I'm proud to be a co-convener of the Cochrane Co-production Methods Group. And I bring a patient-public involvement in evidence synthesis perspective to that group. I was a little bit about me because it kind of shapes how I got into all this. But I was introduced to evidence synthesis when I joined Cochrane over 10 years ago. And I really began the peer review of systematic reviews. And then I joined evidence synthesis teams as a co-producer of systematic reviews. And I use the word join with caution because a few times I actually pushed my way in and other times I actually was invited. So, and I think we've made a lot of progress since then. And for me, my interest wasn't really disease-focused evidence synthesis as I have an ultra-rare condition, but I was more interested in syntheses for topics such as, patient decision aids, chronic conditions, and public health. That has shifted, and I'll explain why in a second. So what matters to me most now is that we continue to meaningfully involve patient, and I'm going to use the term citizen partners because that's the terminology we're using in Canada and also for ESIC, really in that co-production of evidence synthesis, and develop the awareness of co-production in different contexts. And that's where I've been focusing my efforts. And most importantly, the methods that are required to involve patients and citizens in that work. So by different contexts, I mean the type of evidence syntheses that were conducted, for example, during the pandemic, rapid, often living, and focused on public health topics that are everybody's business, hence the word, moving away from the patient to the citizen, and continue to be in high demand. And I think the assumption was that in many cases, the reality that the research question was predetermined to meet a specific, often need of a policymaker or decision maker, and the rapidity of that synthesis process did not lend itself to patient and citizen engagement, where the, you know, where all of our guidance was that the patient and public involvement principle of building trusting relationships could not occur. But we know now that there are methods to involve patients and citizens in these types of reviews, but they are nascent. And I'll add that it may take some convincing to see their true value to this component of that evidence synthesis ecosystem. So in Canada, we found that many citizens were willing to work in a different way to be involved in these evidence syntheses. And fortunately, they told us loudly and clearly what supports they required to be able to be meaningfully involved. Just wrap up to say that there was a great question on our discussion board about whether there are limitations to the active framework that was discussed in the first session. And I don't see adapting some of the steps in the framework as a limitation. I think it requires us to find different ways of involvement. And a good example of that is when the questions are predetermined, it doesn't mean that we can't work with policy and decision makers using horizon scanning techniques, for example, to get involved in the questions they're eventually going to come. And I truly believe that our challenge is really to cast a wider net and develop methods to co-produce in all types of contexts. Thank you.
Fantastic. Thanks, Maureen. I think we'll be touching on a lot of the issues that you've raised in that introduction as we go through some of the questions. But finally, as our fifth member of the panel, Sophie.
Thanks, Alex. Hi, everybody. My name is Sophie Staniszweska. I'm Professor of Patient and Public Involvement and Engagement and Experiences of Care, based at Warwick Medical School in England. We're sort of in the middle. Shakespeare country is probably the thing to think of. I'm really pleased to be part of the panel. The work that I do, many different sorts of projects, and one of the key things for me is the work we do around co-producing our publication, research involvement and engagement. So we're the first academic journal to have a co-production model with a patient as co-editor-in-chief. And that's certainly over the decade we've been undertaking that work, really given us a different perspective on co-production. So I undertake research to develop the evidence base for practice. And I guess that's where I'm coming from. So in terms of thinking about what's important to me, in synthesizing evidence and in its creation, when you work in patient and public involvement, you very quickly realize that the evidence you have is usually not complete, and patients and the public and citizens and our communities bring unique forms of evidence that we academics don't have. And that's really powerful. When you combine that with the research knowledge that we create together, it means that the concern that some of our evidence is missing goes away a little bit. And we did write a paper called Some of Our Evidence is Missing in HTA, because it often is from the patient perspective. I think the other aspect for me that's really important is often our focus is on content of research, but actually the methods we use to create that research and to create the evidence syntheses are also really important. And I'm a firm believer in exploring the potential for public involvement in not only critiquing the methods we currently use, but thinking about what they would look like in the future. And finally, for me, a key component of certainly some of the work we've been doing is how you involve patients and the public and citizens in implementation of evidence. And that needs to start right at the beginning. So we need those conversations to be happening when we're thinking about the sorts of aims of a review or even the aims of a study. But we know from work we've done on our Piper study, the roles for patients and the public in implementing evidence is really, really important and significant. So I'll pause there, Alex. Thank you.
Thank you, Sophie. So I hope that everybody who's taken the time to join this panel discussion and to listen in realizes what an amazing panel we've got and what a fantastic opportunity we have now in the next 45 minutes to get the views and ideas and perspectives of these 5 people who've got different experiences and different perspectives. We have got a whole lot of questions that have been submitted onto the discussion board that people were able to add questions to when they registered for this, but we really welcome people to put any more questions into the chat. So while people are thinking about what questions they can ask these wonderful panelists, I think we'll kick off and tackle some of the questions that were submitted on the discussion board. So I think maybe we just start with the big one. So there's a whole lot of questions that came in really about the future of evidence synthesis and co-production globally. So John, I'm going to go to you with these ones, and maybe there's two questions that you'd like to try and tackle at once. There's one specific one that's how might ESIC shape the future of global public goods like Cochrane Reviews? But then perhaps alongside that, you'd like to touch on the question, what does co-production of global evidence synthesis look like going forward? So over to you.
Great. Thank you very much. So if any of you aren't familiar with ESIC, the easiest way to kind of wrap your arms around it and appreciate its complexity is to go to the website, which is Evidence SIC, so Evidensic. And if you go there, the first 5 primary gateways describe the year 1 foundational investments. And I'll just walk through them, but also talk about one of the likely year 2 foundational investments, which is an investment in methods transformation, because I think so much of what's going to happen with ESIC provides such exciting opportunities for those like you who are all committed to co-production. So if we start with the proposed regional hubs, 2 hopefully will come online in the next month or 2, one in Africa, one in Latin America and the Caribbean. The most important activity that they'll undertake related to co-production is convening regional panels of citizen partners. So the type of work that Maureen has been leading in Canada, bringing together, training, supporting a set of citizen partners able to jump onto new evidence synthesis work, that's now going to be facilitated by these evidence intermediaries who normally work at the country level, but who will come together to set up these regional citizen panels. So that's going to be a really important asset. As I mentioned before, with global public goods like Cochrane Reviews, great when you involve 1 or 2 or 5 local citizens, but if they really are meant to be global public goods, how do you bring in voices from Africa, Latin America, and the Caribbean, the Middle East, and so on? Well, these regional hubs will help. The second thing, and this comes back to the year 2 foundational investment on methods transformation, is this notion of how do we support a move to policy scale, AI-enabled living evidence syntheses. And I think this has really big implications for co-production because very often Cochrane Reviews deal with very, very focused questions. And that's often where citizens' passion is. They have personal experiences with those focus issues. But if we're also going to answer big policy scale questions, like what are the full array of preventive services that should be offered to each population segment, suddenly you lose some of that direct connection between people's lived experiences and the question being asked. So how do we find a way in for citizen partners when the work starts to become in part much more policy scale? I think Maureen and others have already shown that citizens can be part of living evidence processes, so I'm less worried there, but I do think we really need to think about how meaningful citizen engagement looks in a world of policy scale synthesis. The third area of investment are sectoral hubs, and I think the big change here for citizen partners that are connected to Cochrane is going to be these sectoral hubs that are doing evidence syntheses in many spaces are going to have their own citizen partners that they're used to working with, and they're going to be inviting health-focused citizen partners like Cochrane affiliates into the mix. So there may be a sectoral hub focused on humanitarian assistance, used to working with citizens drawn from refugee camps and similar environments. How do we bring in Cochrane engaged citizen partners to contribute as well and to kind of open up thinking to a set of different viewpoints? Some of you may have seen yesterday the new call went out for the 5 new sectoral hubs. So 5 new ones will be funded coming on stream. Tremendous opportunity for Cochrane trained citizen partners to get involved there. The fourth one is the open data system. And this is going to allow us to do things like extract data once from studies, do risk of bias assessments once, and use it many times. What I would love to see is that we extract information from every study about the extent of citizen engagement in the primary research. We can, of course, also document it in the synthesis process, but wouldn't it be amazing to have data at the study level that we could reuse about the extent to which citizen partners were directly involved in the primary research that's being synthesized. The last one that I'll focus on, and apologies for taking so long, is the monitoring, evaluation, and learning infrastructure. This June, likely, Wellcome will procure the monitoring, evaluation, and learning infrastructure for ESSEC. And one of the exciting things that will allow us to do is to systematically track co-production. So in all aspects of what ESSEC is doing, we will hopefully have a mechanism in place to systematically track that information so we can learn and improve over time. So those are 5 examples of major new initiatives that ESSEC will be putting in place. For some, they will make co-production easier to do at scale. In other cases, like the move to some policy scale questions, they'll introduce new complexities that I hope this group can be part of leading thinking about how we work that through.
Great, thank you. Euphrasia, do you want to come in?
Yes, please. I just want to add that it's really a privilege that I, as a person, am part of ESSEC, and I think ESSEC is walking the talk because we were engaged, myself and other system partners like Maureen and Richard. We were engaged right from the very planning stage of ESSEC. So I think that is a shout out there, John, and I think that moving forward, we look forward to see more of this engagement at every stage. So thank you.
Thank you. I'd like next to go. We have got a question in the chat, and I think as this is people have given up their time to come along, we should take time to answer these questions live. So there's a question from Angelica, which says, "Thanks for all the great contributions from the panel. I work for Cochrane Germany. When I think about how patients and the public in Germany can be actively involved in Cochrane reviews, I always struggle with the language barrier. How can this be dealt with and perhaps be overcome to some extent?" Does anyone from the panel want to jump in with their thoughts on that one?
Maureen, do you want to come in, perhaps you and Euphrasia, with your thoughts about whether and how worldly, I think that was the name of the application we used in the ESSEC planning process that allowed for us to have meetings in multiple languages simultaneously. Do you think that helped to advance the engagement of people who come from other language traditions?
I can chime in. I think it did, John. But I think what also helped was just that personal touch of also saying, like, we understand this isn't your first language. It could be your second, third, or fourth. And we're going to try to create an environment where all of your contributions can still be really important. I'm just going to say I come from a country where we have 2 official languages, so English and French. So we do deal with this in Canada. The translation tools have evolved very, very well now. And they're really good. And I think we definitely use them. You still have to have someone reviewing everything, but we can quickly put something into another language and get feedback. And I think we need to use those tools as much as we can and to meet people where they are. But I know that from attending the consensus meeting in Cape Town, you know, someone coming up to me and saying it was a welcoming environment. And people spoke slowly. They were aware that people were there for the second language. There were also tools, but I was also able to actually follow a lot of the English because there was attention to that, and it was always in translation. And it used to be a huge budget item to do that, but now with the tools that are available with AI, that budget has gone down substantially. So I'm hoping that people will make more use of that. And hopefully that helps, Angelica. It's a great question.
Thanks, Maureen. I wonder whether, Maureen, we should stick with you. And there's been some sort of general questions about co-production in evidence synthesis. And I wonder whether you'd like to tackle a couple of them. It sort of follows on from what you've just been talking about. So one of them is, what does co-production look like in different contexts? So such as different types of reviews and rapid reviews. And maybe you could also tackle alongside that, because you've already touched on it, how does co-production as a concept vary internationally, and how do we adapt to that?
So that's a great question. It looks quite different when it's done really rapidly. We've been able to do it in Canada. I don't know if we're really, we're still working towards true co-production, but we certainly have people involved in various stages on your active framework. But it's all about transparency. So we do a lot of training, and we say, like, this is going to be done in a 2-week period. You're either available or you're not. Like, we can't stretch this out over months. This is what it looks like. And if you're interested and you want to jump on board, that's great. But how we develop those trusting relationships is that we create a group of people who we go back to. And we have newsletters and we have training, and we do bring them together to take that whole piece about trusting and relationship building, to try to work on that, but to be very conscious that, yeah, this isn't a 1-year project. And what we heard during the pandemic was that, when we put a call out, 80 people responded in a matter of 2 weeks. Every day, people from all walks of life saying, yes, I want to be involved. I was just blown away by that, because I thought, and we can't always be flexible. But that doesn't mean that we can't get involved. So the assumptions that are often there shut patient and citizens out, because we're not following the playbook. And the playbook is great for the longer projects. It doesn't work for the shorter projects. So that's my message. And it's really about transparency and just being very clear. This is the request. Are you available? Do you want to do this in this timeline? And people answer me usually within half an hour when I send out a request. And like, it's unbelievable, because I also have told them, you have to answer me within 24 hours if it's a work day, because we need to get people on this project. And they've said, okay, we're willing to do that, because we think it's important that you get those citizen voices. So, and to talk about the international, the variety is just, we have to meet people where they are. We can't preach to them. We can't say, we do this, so you should do that. We have to listen to them. We have to listen to what their needs are. And so Euphrasia and I have had many conversations about that. It's not the same, and we have to meet them there and work with them to, if we have something that we'd like to share, that's great. And maybe it's just really learning from them and finding out what it is that the ecosystem can do to support that work. But I think my big message is, don't make assumptions about that really shut us out, because it's different, and it does look different. So I'll stop there.
I just wanted to chime in there, Alex, and echo what Maureen said of when working on an international context and listening to people. I think that's the number one thing that I've learned working over time in this field, is listen and learn from the people who are local and that you're working with on the project. And that's how you build trust as well, and showing that you're listening and learning from them. I'm Canadian as well, living in Ireland, but when I worked in Canada, we often work with Indigenous communities, and I'm not an Indigenous person myself, so I couldn't say what was right or wrong in different contexts. And trust is definitely can be an issue in Indigenous populations. And so my number one thing I open up with is, I'm here to listen and to learn from everyone here. And then how can we work together moving forward?
Thank you. That's great. There's a question that I think is a sort of natural follow-on to this. And Euphrasia, I wondered whether you'd like to sort of have a first go at answering this. So it's so far we've heard from April and Maureen in terms of the views almost from the researchers' heads, but there's a question about what would people, public contributors, consider effective support of their involvement in co-production. And I wondered if you could speak about that from your perspective.
Yeah, thank you very much, Alex. I just want to take us a little back to the question in the chat. I'm very sorry, Angelica, to hear of your language barrier, and I will encourage you that Cochrane is making efforts to actually get translators from the consumer perspective actually to translate things like plain language summaries that you can actually take part in reviewing. So to come to your question, Alex, I'm from my personal perspective, actually involvement in my context or co-production in my context can be very, very challenging. So I am based in Cameroon, as I earlier introduced myself. And apart from language barrier, we have other barriers like technology, access to technology. We have issues of internet connectivity. We even have issues of literacy. So at times, support can actually be of very great use, like support from the very onset of training, making available the necessary technological infrastructures, and even to the extent of actually accompanying citizen partners, even in their experience, and mentoring them on how to actually project that and get meaningfully involved in research. So from my perspective, support can be very, very relevant. So I want to share the example of the People's Review. My experience with the People Review has been very tremendous because from the very first stage, we actually got the necessary support from the very first stage, because in each of the stage we have embedded training models that actually gives you all the necessary support, and even the communication has been incredible. So a shout out to Ellie Queen if she's in the audience. That is a very wonderful and exemplary example of effective co-production and meaningful engagement of the citizen partner. Thank you.
Thank you. I can see that April shared the link to that if anyone wants to read about the People's Review anymore. Anna, I can see your hands up. I don't know if you want to join in the discussion or ask a question, but go ahead.
Yeah, I would like to join the discussion. Thank you. I'm Ana Pizarro, and I'm based in Colombia, and I wanted to talk a little bit about low and middle income country representation. I do work for Cochrane, and I often hear people asking me, like, how do I involve people from low and middle income countries? It's so hard. It's difficult to find people. And I have a perspective based both on my own experience and what I've seen in initiatives like ISIC and other global collaborations. And one thing that I wanted to emphasize is that motivation and talent are not the problem. There are many people in low and middle income settings interested in co-production and evidence work, but recruitment alone is not enough. And the participation from low and middle income country settings often comes with many additional challenges, as Euphrasia said, limited protected time, unstable funding, and other responsibilities. So what makes the difference is not just recruitment itself, but the support in a structure around participation. We have to think that there are different realities, and like what I face and what I live here in my country, it's very different to what I can find in somewhere else. So we have found in our co-production methods group some low-cost approaches that we would like to do and make that they can make a big difference, such as pairing new members with a buddy or a mentor during the first months, short check-ins before the meetings, also clarifications, clarifying expectations early, and also involving new members in small tasks so they can engage gradually. I feel like these approaches can help create this sense of belonging that is often what sustains long-term participation.
Thank you. John, do you want to come in?
Well, just to say, what Anna Beatrice described, I think is great. I think part of the reason why I'm so excited about the regional hubs is that the regional hubs are groupings of national and local level evidence intermediaries who have built trusting relationships with their local citizen partners. They know what their context is like. They know what their support needs are. They speak the language. There's so many reasons why it would make sense for global entities like Cochrane to connect out through the regional hubs to these well-supported individuals who can then leverage all the supports that are in place already around those individuals. So I'm just really excited about complementing what Ebai-Atuh described, where global groups kind of reach out and develop their own relationships, but also where they work with groups that have over years and in some cases decades built up those local relationships and can support individuals' participation in these global efforts. Thanks.
Thanks. Sophie, you come in.
Yeah, just to add to those points, I think part of the excitement, I think, of the sound of the global hubs is the potential to develop the evidence base for practice by ensuring that we capture those different contexts and really develop that understanding of what works for whom, why, and in what context, but in ways that actually see that as a form of evidence that we gather, that we report, that we publish, and that underpins the work of perhaps regional or, or the sorts of centres that John's been describing. So I think part of it, this for me, is that sense of this is an area of evidence-informed practice. It varies enormously, but we have to be really mindful of the context people work in. But it's a really difficult area to get funding for, to develop this evidence base. But it's so critical. It could really help us to move forward and develop that effective practice.
Thanks, Sophie. And you've led very naturally on to some of the questions that are on the discussion board. So I might just come back to you with a couple of those, if that's okay.
Yeah.
So there's a question which you've started to touch on, which is how do we develop the future evidence base for co-production of evidence synthesis? So maybe you could sort of dig into your thoughts on that a bit more. And then alongside that, there's a question about what does co-production of future methods for evidence synthesis look like? So maybe you want to just tackle and say a little bit more about your thoughts on those.
Yeah, absolutely. I think the first thing to say is that I think it's really important that we recognise the legitimacy of developing an evidence base for co-production and partnership practice. I think this forms part of our evidence thinking, or it should do, but I think we still struggle sometimes to see that as a legitimate activity within evidence synthesis and within partnership working more broadly. So I think the components of a future evidence base need to be based on really high quality, transparent reporting. And to do that, we need to be able to capture the work we do. And by capture, I mean whether it's record or reflect on or just be aware of what's happened. And sometimes those effects are micro. It could be something small someone says in a meeting that becomes translated into a really significant impact in a project. So that capacity for us to capture processes, the way something is working, and to really understand that underpins the high quality reporting. And I think reporting is a big thing for us for the future, is being able to develop an evidence base for partnership practice and co-production that is transparent and other people can use is going to be critical. And we've made some really important steps in progressing that with development of reporting guidance like Consort and Spirit that now have items on what we call patient and public involvement and engagement, but also Cheers with health economic evaluation. And all of these add to the strength of the evidence-based development, because they're saying to researchers and to our public contributors, if you did it, tell us what you did in as much detail as you possibly can. If you didn't do it, tell us that too, because that's important. But also it might make you think about why you didn't do it and perhaps do it next time around. So I think we need some key foundations. I think we've already got a lot of those key foundations for a future evidence base for practice. The difficulty we often have is the funding to support its growth, and that's probably a big barrier for thinking about sort of future methods. But I think the potential we have just thinking about the future methods question, I'm a great believer in unraveling methods and methodologies. If you sit down with a researcher and get them to take you through a particular approach, you learn so much about how it's constructed and why. And we've done this in a really challenging area of mathematical and economic modelling. So we've unravelled that as a method, and we've really thought hard with our public contributors about how do you bring in the public involvement, the partnership perspective, and how do we co-produce that knowledge? And we've developed a very, very comprehensive framework that takes us through the modelling. And I think for me, there's something about the legitimacy of that for the modelling community, because suddenly they've got something which guides them through the potential process they might follow. So when we talk about methods, I think we've got a job to do to unravel our methods together and think, are they fit for purpose? Or do we want to be doing something else? And what are the assumptions we're making here? And how could we work together to improve what we do? So I think I'll pause there, Alex, if that's all right.
John, you want to come in?
Well, just to say that it feels like we could be entering kind of a golden age of research in this space, because suddenly we have these extraordinary opportunities for cross-context evaluation. So looking across all sectors, not just within health, looking across all geographies, all world regions, not just the usually studied ones, looking across languages, as we've said before. And as I noted also, looking across scale of questions. So does co-production look different for a more narrowly focused question, more directly aligned with someone's past lived experience than what it looks like when it's that much, much bigger policy scale question, which is critically important, but so much more removed from the day-to-day realities of many of us. So I just think this is an incredibly exciting time for the leaders like Sophie and many others who do research in this space to think about taking advantage of this natural experiment that will happen over the coming years, where we'll have so much exciting variability that we can study and learn from.
Sophie?
Yeah, just to come back very quickly on that, I think, John, you're right. It sounds really exciting. I think there's enormous potential, and certainly we've worked with groups where you're much closer to policy, like our vaccination work. That's directly informing policymakers. So the public contributors we work with have a more strategic approach. They're not necessarily lived experience practitioners or people who bring that sort of knowledge. They're people who look at things sort of in the round. So it's a different interaction, but they're incredibly powerful and effective at saying, do you realize that you've made a set of assumptions there? Are you absolutely sure that's rooted in your evidence? So those sorts of interactions, I think, offer a really good model for thinking about how these sorts of connections can be made. And I can imagine an incredibly powerful community of practice developing internationally, and a recognition of those different skill sets people bring. That's, you might have lived experience, but you might also be a strategic public involvement practitioner who has a very different perspective. So I think recognizing the range of roles and contributions that exist is part of that evidence-based development as well. Thank you.
Maureen, I would love you to come in here, because I think you personify for me the type of citizen partner who can move from, a very particular living with chronic disease world to this super duper big health policy systems type questions. And you have identified and nurtured a cadre of people that are like you. Do you want to come in with what that has involved?
Yeah, it's very interesting. I was at a conference about a year ago, and someone said to me, "What's happened to you? Have you dropped your patient hat?" Like, kind of really a little bit nasty. And I said, "No, I'm always going to be a rare disease patient, but oh wow, this, what's happened during the pandemic and everything else has awakened another side of me." And I really like all of those policies that are being created are affecting everyone's life. And so of course not. It depends on the hat that you're going to wear. And I thought, well, 25 years ago, I was the public member on the placebo initiative. So it's not something different, but it just depends on what is of interest to you. And we found out that there are people who want to do work beyond their specific, disease condition, and who want to be involved in public policy and in doing it. And that was very exciting. And we're trying really hard to bring them in, and to, sometimes it can be limited because there's less flexibility, but the interest is there, and it's so important. And we try to, one thing that we do is we're very interested in reciprocity, but when our citizen partners comment on a review, the researchers who were leading it go to every comment and respond. That takes a lot of time, and tell them if they used it or they didn't use it, why. And people are saying, wow, like that's just making it or breaking it for me, because now I'm understanding like what you're able to use, what's useful. And I understand that my voice really does matter. I can see all the changes. So I think it's really, I think it's just a very interesting area, and that you shouldn't assume that patients only want to do patient work that's based on their own condition. And if that was what I did, I would be doing nothing, because I have a treatment for my condition and there's no research being conducted right now. But my goodness, like I've got all these other interests, and I think there's a lot of people like me out there who want to do that kind of work. And we need both. Like we need the people who are disease focused, who are bringing that lived experience. That's extremely important. But there's also a place for others, and that policy world is a really interesting world to come into. And I think that people just were awakened to it during the pandemic, when they realized that, whoa, like they're setting policies and practices that are affecting my daily life, like whether I'm going to school or not, or what I'm doing. And I think that just, that was a huge awakening for a lot of citizens. And I think we just kind of rode on that and thought, okay, we've got all these people now, and let's do some training, and let's try to get them involved. So I think the transition was caused by external factors that we just basically thought, okay, this is the right time. And I agree with everything John and Sophie have said. This is a very exciting time for evidence synthesis, and there's a lot of opportunities out there. And I just wish I was 20 years younger. What happened 20 years ago? Stop it.
Thanks, Maureen. I'm really enjoying sitting back listening to this discussion. It's great. Can I just remind everyone who's listening in that you've got about another 5-6 minutes if you want to have a question answered by the panel members. So this is your opportunity. So please do put it in the chat if you've got a question. Nicole, I can see that you've asked a question. Do you want to unmute yourself and ask it in person?
Okay, if you want to hear my voice, thank you, Alex. Thank you, everybody, for this great discussions. Yes, I was just thinking about my involvement in the co-production methods group, and that basically I'm a researcher by training, and I've always felt like I've done co-production poorly, if at all. And that's how I got involved. And I wanted to ask, how much do we think collectively we could learn from instances of poor or unsuccessful, I'm not quite sure how to call it, but co-production instances where it hasn't worked for the co-producers? And if we think we could, how might we go about gathering evidence about this? Thank you.
Great question. Who would like to tackle that one? Sophie?
I can pop into that one. I think it's really, really important we understand what poor practice looks like and why it happens. And sometimes I think it happens because studies are underfunded and people really just haven't been able to, even if they want to, sometimes the budgets get cut and it's really difficult for researchers and the public contributors to work together. I think one of the things that certainly we've done when we've developed a co-production process has been to include reflection sessions where, aside from the project work, we sit back and we take a deep breath and we say, what's working well, what isn't working well, can we have a reflection time? And that sometimes takes a few meetings for people to feel they can finally tell you the things they're not happy about and the things they'd like you to change. But actually, that's really key in relationship development, because once we have that trust and honesty, we can start making changes to the way projects are running. And we've had that with when we've tried to work on a realist evaluation and we got into such a tangle with what's the context, what's a mechanism, what's an outcome. And collectively we said, gosh, we're all struggling with this. And it was a real moment of breakthrough where actually, it really changed the dynamic of something we were all struggling with. So I think there's things you can do, and reflection sessions can work very well because they set us back on track. We agreed together, what do we do in the next meeting and how's that going to work? It wasn't an easy process, quite a painful one, but a really necessary one. I'll stop there.
Euphrasia, do you want to come in?
Yes, please. I wanted to indicate that one way to actually evaluate your quality of co-production could also be to open up and be very transparent and to open up to feedback from those we have involved. Actually, I take the example of the people's review again. I think that we had the opportunity to be interviewed and to ask about my feelings and opinion about involvement. So I think that if you have, you could incorporate the aspect of feedback, a very rich feedback culture in the various stages of your involvement in co-production, and that could help you to gather a lot of information for you to be able to assess your quality of involvement, and then as well as also to even get opinions or ideas on how to improve on your co-production.
Yeah, thank you. Let's go to Maureen and then April.
That's a great question. We led a couple of focus groups after the funding kind of stopped for some of the pandemic work that we were doing with citizen partners. And one of the first things that we, people talk very openly about their experiences. Someone said, "Oh, it was sometimes a little rough working with the research team," and I said, "Well, a lot of them had never ever collaborated with citizen partners, just not done in that kind of work." And someone said, "Why didn't they just tell us that? Like, why weren't they transparent and say, 'Hey, we're new at this too'? We would have cut them more slack." I thought that was kind of interesting about the transparency piece. And the other piece was that people were saying, we did this work, but we didn't know where it was going. Like we didn't know what were they going to do with it. So, and the researchers who were there said, sometimes we don't know. So now we have a section in the request form that clearly says who funded the work and what the plan is. And if they don't know what the plan is, they say it. We're like, we don't know. Like, we don't know what this might lead to or how they're going to use it. Like, and that honesty in the first session, Andrew Trico said the biggest barrier and facilitator is communication, and that honesty piece of it, saying, we want to know, and if you don't know, just tell us you don't know, and that's good. So that informed so much of what we then developed to continue doing that work, was just hearing back from them. Now the issue is we need to publish all of this. And how do you balance doing all this good work and finding the time to then sit down and publish it? And that's a real challenge, because doing the work itself is a huge lift, and you've got to be so attentive to all of the people who you're working with. But if we don't bring this out and we just use it for our own knowledge, then it's great. Like, our program is going to improve, but how is that going to help, with other groups? So I'm always kind of aware of that and thinking, and hopefully with some of the ESSEC funding in the monitoring and evaluation piece, we will have a way to capture some of those experiences. But yeah, the communication piece was very interesting. People just want people like me who are doing this work as non-researchers, just want honesty, and just lay your cards on the table and tell us if you don't know. And that really helps us, rather than us thinking that, oh, there's something going to happen with it, but we're not going to be part of that conversation. So.
Yeah, and I was just going to sum up or wrap up what everyone was saying, and that what I'm hearing is communicate often, be a leader in the space if you're a project lead, by starting those conversations early and often, and just be honest and transparent. And I think that goes a really long way in this space.